Today's class we are going to see about the tonsillitis. Introduction. Tonsillitis is the term commonly used to describe the inflammation and infection of two palatine tonsils. Tonsils are protective lymph glands that are situated on both sides in the throat. The tonsils constitute an important part of the body's immune system and are vital defense organs. They protect the body from bacteria and viruses by fighting these as soon as they enter the body via the oral or nasal cavity. Here is an picture which depicts the normal tonsils and inflamed tonsils. Tonsillitis is usually defined as an inflammation of tonsils and characterized by sore throat and fever. Incidence. The incidence of tonsillitis peaks between age 4 and 7 years. Group A beta hemolytic streptococcus infection occurs most frequently in the winter and it spread more rapidly in crowded living situation. Etiology of tonsillitis. Bacterial and viral infections can cause tonsillitis through droplet infection. The common cause of bacterial agent is group A beta hemolytic streptococcus. Other common causes include adenoviruses, influenza virus, Epstein-Barr virus, parainfluenza virus, enterovirus, herpes simplex virus. The triggering factors of tonsillitis includes food with artificial colors and preservatives, peanuts, cold foods, cold drinks, ice creams, changes of weather, extremely cold climate, damp weather, exposure to a lot of pollution, sour fruits, lemon, pineapple, grapes, oranges. Now let us discuss about the clinical manifestations. Signs involves red and swollen tonsils, white spots on the tonsils, enlarged lymph nodes in the neck region, bad and foul breath, cough, running nose. Symptoms: soreness of throat which may be persistent and recurrent, difficulty in swallowing or painful swallowing of food and drinks, pain or discomfort while swallowing saliva, change of voice, pain in the ears, headache, malaise, tiredness, difficulty in taking feeds in babies. This may be the sole indicator in some cases of tonsillitis in infants. Now let us discuss about the types. Catarrhal tonsillitis. When tonsillitis are inflamed as part of the generalized infection of the oropharyngeal mucosa, it is called as catarrhal tonsillitis. Membranous tonsillitis. Sometimes exudation from crypts may coalesce to form a membrane over the surface of tonsil, giving rise to clinical picture of membranous tonsillitis. Parenchymatous tonsillitis. When the whole tonsil is uniformly congested and swollen, it is called acute parenchymatous tonsillitis. Diagnostic evolution. Get a detailed history collection, physical examination, redness and swelling of tonsils, pus pockets on the tonsils, discharge from the tonsils. In case of peritonsillar abscess, there may be shift of the involved tonsil towards the center of the throat. The umula may be shifted towards the opposite side, away from the affected tonsil. The throat swab culture. This is used to get a sample of the secretion from the back of the throat. Rapid streptococcal antigen test, rapid strep test can accurately screen for a group A beta hemolytic streptococcal infection. Monospot test, blood test can detect certain antibodies which can help confirm the person's symptoms are due to mononucleosis. Epstein-Barr virus antibodies. If a monospot test is negative, the antibodies in blood against EBV might help diagnose mononucleosis. Blood test. This is primarily includes a complete blood count which is done to confirm the presence of infection. Thank you.